Spirit. All right. Welcome everyone to the 2023 PI conference. We will get started in just a minute. Spanish interpretation is available for this session. You can access the Spanish language line by clicking the world icon in your Zoom toolbar. My name is Colleen Brock. I will be your moderator for today's panel on how to advocate for yourself or loved ones while navigating a visit to the emergency room. There will be time for questions at the end of the presentation so that you can ask today's panelists. Please submit any questions you have in the chat section of the platform. Please note that our guest, labeled as technician, is here to assist in today's recording of the Spanish session. And if you have IT questions as an attendee, please visit the help desk in the attendee hub. So without further ado, I'm excited to introduce our guests. And I am going to spotlight Dr. Morna Dorsey. Dr. Dorsey serves as director of the Pediatric Allergy and Immunology Center, a pediatric immunologist and allergist. She specializes in caring for patients with inborn errors of immunity, various immune disorders resulting from genetic mutations. She also serves as co-director of UCSF's newborn screening program for severe combined immunodeficiency, SCID, and directs the Pediatric Allergy and Immunology Fellowship Program, which trains doctors in this subspecialty. So good morning to you.
Good morning, everybody. It's great to be here with all of you.
And I am going to take this down, and I hope, what are we seeing now? Hopefully us. And with that, sorry about the technical issues. With that, I would like to introduce Kelly Caton. And Kelly is from Escalon, California. So we have two from California today. She has been a registered nurse for 11 years. She is passionate about education and advocacy for the IDF because her 7-year-old son, Kanan, has CVID. Kelly has brought education to the resident physicians at her local hospital via class sessions on immune deficiency. She has attended events at local schools to help educate children on things like hand hygiene and COVID precautions. She has also hosted education events with local school educators. In April of 2023, Kelly attended Advocacy Day with IDF in DC. So we are thrilled to have you, Kelly, join us.
Thanks for having me.
You're quite welcome. And to give everybody just a little background about myself, I am also a registered nurse for a few more years than 11, but we don't need to add that many. I am a pediatric and PICU nurse by trade. I am the manager of medical programs at IDF. We have 2 young adult children now who have CVID, but we have been in this realm now for 28 years and 22 years respectively. And I also was diagnosed about 9 years ago with CVID. So I come at this from a perspective of patient, parent, and a medical professional. So I think between the 3 of us, we definitely have the ED covered. And with that, we are going to start with some questions. So, Dr. Dorsey, if I am going to the ED, either as myself or with a loved one, what information is critical for me to share? And I'm going to preface that with, there are 2 situations, obviously, which somebody's going to find themselves in an ED. One is critical, life-threatening, and the other is very sick. So what advice do you have for information that somebody should share in both of those situations?
Yeah, thank you for that question. So there's a lot that you should share with the folks in the ED when you come to the emergency room seeking care. But I would say that if it's a situation where you're concerned about an infection, and you yourself and your families are going to know you best, and they're going to know when you're not feeling well, and they're going to know when this is a situation where emergency care is needed. And the issue with patients that have primary immune deficiency or inborn errors of immunity is that their response to an infection isn't always going to look like a healthy host having an infection. So in fact, there may be a really serious infection going on, without sort of some of the outward signs. So it would be important to say, my child or I can get infection, or I can be very ill and not have some of the typical findings that an emergency room doctor would look for, like a very high temperature, or let's say a high heart rate, or, abnormalities on blood work. So that's an important thing to sort of get across. And I think explaining that, to the best that you can, explain sort of what the defect is that you have, and the medications and the specialists that you see in order to keep you healthy. That gives someone a better idea of how immunocompromised someone is. So if you were to say, I have to take these medications to keep my immune system healthy, I see these doctors, that helps the physician understand, okay, there's a whole team working with this person to keep them, keep their immune system healthy. Those are two things that I would think right off the bat would be a good thing. The other thing to mention is that it's always good to say, please call my immunologist or my infectious disease person, somebody who knows you well, knows your immune system, your history of infection. Always offer that as, and most of the time they will take you up on that, unless they're really, really busy. But I think talking to another physician that knows you outside of this emergency setting is really good. That's good information. But there's a whole list of other things, but I'll just pause right there.
Kelly, what advice do you have?
I think everything Dr. Dorsey said is very accurate from my visits that I've had with my son to the ED, especially if you're presenting for an infection that you're concerned about. I kind of wanted to direct a little bit in another way too, that if you're needing to present to the ED for something that has nothing to do with your immune system, for example, I had to take my son a few years ago in for a dislocated elbow. Clearly that had nothing to do with his immune system. So I really didn't go into any of that because I didn't need to. He wasn't there presenting for a reason that I was concerned that they needed to reach out to his immunologist. So I think that really realizing as a parent or as yourself when you go in, is my history in this given situation relevant? I think that's important because you can kind of skip over a lot of things if it's not going to change the care you receive that day while presenting to the emergency room.
I think that is wonderful advice. I also think you have to really think about critical versus non-critical. There are situations. So if somebody has a stent, if somebody has a severe allergy, if they're on blood thinners, whether or not they have a PI in a critical moment, say they've been in a car accident, something like that, those are the things that are vital for that person who is caring for them to know versus whether or not they have an immune disorder. That's going to come into play later with long-term care. But in that moment of critical care, you have to think about what do they need to know. And that I think is the big determining factor of what you tell them and what you can hold back on. So going in sick, one of the things that we do know is we can present like we look relatively healthy, but we are not. And so how do you convey to an emergency room doctor that you are sicker than you appear? Whether you don't have a fever. Well, maybe you've never run a fever in your life, but you've been septic before and hospitalized for it, or your white count. So like for me, my normal white count is 3 or 4. So if I have a white count of 10 or 12, I've got a big problem, but they may not realize that. So at what point, Dr. Dorsey, do you kind of go with the, I'm a lot sicker and you need to pay more attention? And how do you do that?
Yeah. Well, I think that's a really good point that you bring up. It's clear that there are some conditions where the inflammatory response is blunted. It's just that whole pathway, and there's several pathways that result in an inflammatory response that promotes the production of, proteins that help to, attack and fend off pathogens. And in many individuals, that those pathways are blunted. So you're right, fever may not be there, white count may not be elevated. One thing that we have found is helpful is if your physician, your immunologist, is comfortable with writing a letter that you can carry with you, and take the emergency room. This is the condition that I have. This is the type of presentation that I might have if I have this kind of infection, and sort of the contact information and phone numbers. And so I feel like that is sometimes, and that's typically well accepted in an emergency setting. So if the type of immune condition that you have is a little bit complex, then I think getting a letter from your physician is helpful, that you can carry around with you and present. I think aside from that, having the physician reach out to the immunologist, and sometimes we'll have patients call us while they're in the emergency room saying, please contact so-and-so in the emergency room so you can explain what's going on. And we're happy to do that as well. But I think that these are all really important points, that, again, someone with an immune disorder isn't going to present the same way as someone that has a healthy immune system, and the typical markers aren't going to be there. I would say, bringing up the history of sort of other infections that you've had, that may also alert them to really look more carefully for infection, possibly do more imaging than they would typically do because they can't see it in the blood work, that sort of thing.
Kelly, what advice do you have?
So what I decided to do, like we said, Colleen said in the beginning, my son's 7. What I did when he was first starting to get sick and then got on treatment, and he's done much better since, but I just have a typed out paper, I guess you could say, that kind of has his history. And I have that for really my own remembering, right? As time goes by, it's, of course, you remember this surgery or this infection, but actually, being able to say in 2016, he had this surgery, which then after he got a cellulitis and was hospitalized. Because if I'm at the ED for an infection that I'm concerned about, as Dr. Dorsey was saying, I want to be very concise and very a matter of fact. So, of course, when you're talking to ED physicians or nurses, a 30-minute conversation is probably not going to happen. I think we could all say that we're not there with that. So I think just being able to say, here are the dates, here are the surgeries, here are the complications, here are the infections, which has required hospitalization, and keeping it very concise. And for me, that's easy to do if I have a piece of paper that just has all of that documented. When we've had to present before to the ED in the past, I even gave that to the physician, and he was so thankful because we didn't have to go through a 20-minute conversation. He just looked at it, was able to see, okay, in the past when this child has presented, post-surgery with an infection, it has become severe and required transportation to another facility, a higher level of care. So it made it very concrete and easy for them to recognize that this might end up being something more than we would anticipate with a healthy child. So I really recommend kind of going through your own history or your child's history and just typing it out and keeping it with you, very simple and to the point.
That's perfect. Also, I put in the chat, the IDF Nurse Advisory Committee created an immunocompromised card for emergency room use. And you can go in, put the information that is specific to you and your situation. You can put your immunologist number or whoever your team captain is. You can add your diagnosis. You can add certain things that pertain to you, and you can present that card at the emergency room. And hopefully that will also help. And especially if you present that right at the beginning, that's going to be sort of that magical key that's going to make them stand up and sort of take notice that, oh, wait a minute, this is not your average sinusitis, or this is not your average even sepsis or possible sepsis, that this could be more severe. So I encourage you to either copy it from the chat, or you can go onto the IDF website and get it from that site. So Kelly, having a child with PI and going into an emergency room is daunting in of itself. How do you explain what your PI is, and how I think all of us have addressed concise is the key word in an emergency room. So how do you explain CVID concisely to somebody who has absolutely no idea what you have just said?
Sure, which that's a great question, because I feel like the times I have presented to the ED, of course, the nurses and physicians aren't really familiar with immune deficiency or CVID. So for me, I'll tell you how I would say it if I were explaining it to a nurse on intake, like a triage nurse. So my son has an immune deficiency. It's called common variable immune deficiency. It means that he doesn't produce antibodies and immunoglobulins like a normal healthy child would. So every 4 weeks, we take him to UCSF in San Francisco, and he receives IV immunoglobulin, which helps him to have a healthier immune system. So having said that, he is not, his immune system doesn't function like a normal child without the supplementation of IVIG.
That's great.
Thank you.
Dr. Dorsey, do you have anything to add?
I totally agree. I mean, I think when you start to talk about the medications or the appointments or the other, the team that's involved in keeping you healthy, that presents a much clearer picture for the physician about, okay, this is a situation where there are multiple people working together to keep someone healthy. They're on this medication that's an IV medication or it's a sub-Q medication. Excuse me. It also represents that it's a chronic situation. So it's every 4 weeks or, every week, however often you're getting the immunoglobulin in whichever way you're getting it. That creates a clear picture about this is a chronic situation. They're requiring supplementation of their immune system, and that automatically, kicks up the concern level to a higher level. And as Kelly said, beautifully, kind of writing out, just sort of very concisely, infection this year, this is what the treatment was, this was the outcome, without sort of overselling it, if you will. It's just sort of letting it speak for itself. This is what's happened in the past. This is what's going on now. It really helps physicians to get an understanding of what they should be looking for.
And I will say that one of the things that I have done, and although our kids both have CVID, I've got one who I swear can vomit on command, and another who needs new lungs and a new nose. And so they present very differently. And when they have been in the ER, I have always kept it to why we're in the ER. So if it is because one of them has been vomiting for 24 hours, and I know that as soon as he starts vomiting, we're done, and he's going to become dehydrated, even though his numbers will say he's not dehydrated, I promise you, the second you start to hydrate him, all kinds of things are going to pop up, including possibly pneumonia. But I don't go into, well, he's had sinus infections and I keep it to, in, like you said, Kelly, even in the past, when this symptom or these symptoms have arisen, this is traditionally what works best. So it again, thinking concise. So if I'm taking her to the ER and it's another respiratory issue, it again is, I'm not going to go into, well, she's also had this and she's also had this and right now we're focused on why we're here, and why we're here is respiratory. So again, in the past, these are the medicines that work the best. This is when she has to be hospitalized and that kind of thing. So I think concise and sticking to why you're there is really important. So then the next thing that I want to talk about is sort of something that I know we've all faced. And that is what do we do? And how do we react and act when they don't believe us and they don't buy into anything that we've explained it. We know what we're talking about. We're educated. This is what we need, but they're telling us, no, that's not what you need. This is all I'm doing, and you can go home. What do we do? Dr. Dorsey?
I was hoping Kelly would take that first.
I can
Well,
take first, Dr. Dorsey.
well, I would say, so the first thing, I guess I would say that in any situation, someone has something to offer, right? It's not like, it may not be perfect. It may not be everything you want, but there is something that the person can offer for your specific situation. I would, I think that after giving sort of your concise history, reiterating the chronicity of the condition, the fact that this could get much worse, and that you're personally concerned about this being something that could get severe. So you've done that. And then, if you have a letter from your physician, that's great. On top of that, you can give that. And then you can offer, the contact information of your immunologist. And I think if the person isn't going to call the immunologist after you've asked them to do it, and they're sort of, I think you can call your on-call person and say, hey, I'm sitting in the ED. They're going to discharge me. I'm not comfortable with this. What should I do? And we're happy to call and make contact with the person who's taking care of you there. And then I also would say that, everybody has their own experience and their level of knowledge that they bring to the table. And so as much as you can try to connect on that level, I think is great. I don't, it's hard to hear that, oh, I'm not getting the care I need. You don't understand my condition. I think that might put people on the defensive, which it should never be in any kind of medical situation, but it could happen. So I think that you can push to a certain point, explain what your concerns are, and then at a certain level, I think you just have to go and ask your physician to say, okay, please connect with the person taking care of me because I'm really concerned. And there's nothing wrong with that. I think that they would actually appreciate it. So yeah, it is really, really tricky. But I would say, like the nurses and the doctors treating you or your child at that moment, they're your best friends in that moment. And so try to explain your concerns, explain the situation. But if you're not really getting that two-way feedback where, usually it's kind of like, I think this, and they'll say, well, I think that, but then you can push back a little further, but not being too too strong in your demands, because then I think that there may be, a situation where they may not listen to you as much. So they are your friends, they want to help you, but if it's not really getting through, I think going outside of that circle of communication and then having, someone else sort of discuss it with them would be totally fine. I think that's what you should do. But those are just some thoughts off the top of my head. Kelly may have some other ideas.
Yeah, I think Dr. Dorsey, I think you hit the nail on the head. It is, to me, I think it's really about staying calm, staying respectful. There's a lot, things go a lot further in your favor, I think, when suggestions are maybe made versus demands. If that makes sense. I think, in the past, when I've had this infection, it's required IV antibiotics because I was sent home and deteriorated and had to come back, kind of explaining that, bringing it back to what's relevant, what has happened in the past, and why you're concerned. I would like to believe that as nurses, as physicians, we want to take care of people, right? So I think that it is in the majority, if not all, of doctors' hearts to want to make sure that you're taken care of. But I think that we just have to stay on a path of, going back to why you're concerned and really saying, listen, doctor, I'm really worried. I'm really worried about my child. I think that just those simple words really go a long ways with a physician. They want to make the right decisions. They want to do the best care that they can. But as Dr. Dorsey said, I think that if you're not getting anywhere and you really feel unsafe to be discharged home, that's when I personally would pick up my cell phone. I would call my immunologist and say, hey, this is what's going on. Can you please connect with this ED doctor, in whatever town that is. The other thing that you always have the right to do is ask to speak to a charge nurse. So if you feel like the miscommunication is between you and the nurse, maybe you feel like the nurse isn't giving the physician the whole story. So they're coming in for, 2 minutes, let's say, to assess you, but you don't feel like they're getting the whole picture from the nurse. Then I would politely ask the nurse, can I speak to your charge nurse? And I would just kind of go up that chain of command if you feel that you're not being heard, maybe by the person that's primarily taking care of you.
Thank you. And I agree. It's a tough situation. We have been very fortunate in that our experiences have been very good, except we've had 2 horrendous ones. I had one where our son had a temp of 107. I got it down. I called the pediatrician. We took him to the ER like they had told us to. They actually called the ER, told them we were coming. I told them everything that was going on, why we were there. I was told he had a cold and I needed to suck it up and take him home. There wasn't any, just give him cold medicine and he'll be fine. They wouldn't even draw blood work on him. And there wasn't, even as a nurse, I knew enough that I could get him into, it was the wee hours of the morning and I could get him until daybreak. And then we would call his pediatrician again and figure out next steps. And he ended up in the hospital the next day with pneumonia, and he spent 8 days in the hospital. But I guess my point is too, sometimes those things happen. If I had been given this advice, I would have done things differently. I would have called his immunologist. I would have called his pediatrician right then and there in the emergency room and said, please, we're not getting anywhere. They won't do anything. But I didn't know. I didn't think. You're in that moment. If you're the person who's sick, you're not thinking clearly. If you're the person who's taking care of somebody who's very sick, it doesn't matter if you're a nurse or a doctor. You don't necessarily think clearly. And I would do it again. But what I want people to also understand, and I talked to somebody just recently who had a horrendous experience, you have the right to file a complaint. And you also have the right to talk to whoever heads up the emergency department. And you can go in, and this person has a plan of action, but it's a very positive one. she is going to go in with IDF materials and she's going to educate the emergency department chief. And she's going to talk to him about her experience and why it was wrong and how she suffered because of it. So I think there's a way to, even if it's a negative experience, put a very positive ending on it. I too went straight to the head of the ED, and we discussed that not even just somebody with an immune disorder, if a pediatric patient comes in with a problem like that, but a child who is chronically ill. And we talked about children because it was a children's ER. And we talked about making it mandatory for them to contact the person's name and number that they are given by the parent if it is a chronically ill child, and discuss what would they like us to do with their patient, because they're only seeing them for a snapshot of a moment in that child's life. Their immunologist, their PCP, their chief of care is the one who knows exactly what needs to be done. And so having the two of them communicate will end in a very positive frame. And I'm sorry for anybody who goes through the negative. It is a difficult and traumatic experience. But I do know there is a way, and we are here to help with materials. Kelly has done an amazing job educating clinicians on what it is and what they can do to give people a better experience and get them the care they need, so they don't end up being admitted, but they also end up being treated and they don't get sicker. So for that, we are very grateful to Kelly. She has done a tremendous job. But we're going to take questions right now. So if you want to start putting them into the chat, you can send them to me as the moderator. And we are getting some, and unfortunately, they're the ones that I worry about. But we have all faced these situations. And I think, again, we learn from each other. And that's what the three of us are here today, is not only to share our experiences, but to help you learn how to handle them if they happen to you. So the first one, Dr. Dorney, I'm going to ask you, when coming in for a possible sepsis, what is the best strategy for dealing with an arrogant doctor intent on lecturing you about your own PI, seemingly based on a quick internet check, who is absolutely sure that your symptoms are due to an allergy?
Let's see. That's a really hard one. So again, I think you both touched upon something really important, is being respectful goes a long way, that you're listening, you're absorbing what they're saying, you're listening to what they're saying, even though you're the one that's in the situation when you're not feeling good, or your child, you are listening to what they're saying. And then you can counter that by saying, well, my child's immune system doesn't respond in the normal way, or I don't respond to infections in a normal way. And I have been diagnosed with sepsis, or I've had serious infection in the past without the typical things like abnormal blood work, a fever, those kinds of things. And I think talking about prior history, the kinds of, what resulted in the past with infections, will really give them pause to listen more carefully. And then if that doesn't really work, I think that having you contacting your immunologist or your primary doctor to say, I need your assistance. I'm in the emergency room. I am sick, or my child's sick. My family member's very sick. And I'm having trouble communicating or, relaying the degree of concern I have at this moment. Can you please assist me? And I know that any physician that sees you on a regular basis, your immunologist, would be more than happy to connect with that person. What I was also going to say prior to just this transition was that if you find yourself in a situation where you're getting sick or your child's getting sick, and you're trying to decide, where should I go? Should I go to the local ED, or should I drive all the way, maybe it's 30 minutes or something, an hour? What do you think? You can call your immunologist or your pediatrician say, hey, it's just an ear infection, or, it's tugging at the ear. It's been going on a couple days. It's just not getting better. And I want to see someone urgently and I can't get to urgent care. Can I go to the ED? That might be something that could be handled in the local ED versus they're not waking up to drink now and they're just completely fatigued. And we've done this before and I'm really worried. I need to take him somewhere. Or he's coughing really bad. He's been coughing for 2 weeks now after a cold. And I'm concerned he has pneumonia. Then you might say, take him to the the ED that understands him the most, the one that has some of the subspecialists there that can help to weigh in. So even before you go on the journey of going to the ED, maybe triaging ahead of time to say, okay, this is something more serious. You should come to your primary center, or maybe you could be treated somewhere locally. That might help to avoid some of these situations. But getting back to your question, somebody's arrogant, I think you could also, aside from talking to your immunologist and maybe the other people who are listening to you, maybe the RN or the charge nurse who's taking care of you, also having their ear in this because they work as a team and so they can share information together. I think if you find one advocate there in your group and really try to connect with them about stuff, that can really make a lot of headway. That's kind of what my thoughts are.
Thank you. So this one makes me smile because I'm guilty of this one. If a parent or spouse is a nurse or doctor, should they maintain their secret identity at least at first, or should they say up front that they are medically trained? I will confess, I stay mute and I do not tell them until they eventually figure it out and they ask me. And I don't do that to be sneaky, but I do. I just want to see how they're treating my child or what they're doing with me, because I know what should and shouldn't be done. And eventually I get busted because I ask too many of the right things. How about you, Kelly?
Yeah, I never say that I'm a nurse. And I think that my son's infusion center didn't know I was a nurse for, I don't know, 3.5, 4 years, actually. I never brought it up. But the reason I don't, honestly, is because if I'm presenting with my son for something, I want them to tell me and explain things to me so that I can understand it. Because just because I'm a nurse, just because you're a doctor, just because, whatever, doesn't mean you know every specialty, doesn't mean you're super familiar with everything that's going on. So if my son presents with something that I'm really not very familiar with, I want to be explained to me. I don't want to ever be spoken to like, well, she obviously knows because she's a nurse. And so personally for me, I never say anything, but like Colleen said, a lot of times I think because of the questions I ask, maybe it gets brought up like, are you a nurse? And then of course I don't lie, but I usually just keep it to myself.
Dr. Dorsey, any thoughts?
I think that's really the best way to go. I mean, I think it also, if you start to talk about yourself and what you do, it kind of changes the whole focus a little bit so that, okay, now they're going to be trying to address you in a certain way, or maybe they'll be thinking, okay, I need to make sure that this person, the parent or whatever, is satisfied with my discussion. And that's not really what you want. You want the total focus to be on the person, the patient. And as Kelly said, we're not all specialists in different areas. And so making sure that those basic things are understood, and we're not talking about complex immune system stuff in the ED anyway. You really just want to know, okay, what are we doing for the fever? Did they take the Tylenol? Did they vomit? Can we give them, those kind of basic things that don't need a lot of extra training. But I do think that just trying to keep it focused on the person who's sick is good. And they'll probably know. And if they want to know, they'll say, oh, are you are you in the medical field? And then that can be discussed in sort of a more casual way and more friendly way. That's all I would say.
And
Yeah,
you want them to do their job. You don't want them to feel like they're being judged. I
totally.
just
Yeah.
want them to do their job. And you don't want to add anything to it. Next question. What is the best way to ask for a specific treatment that you know you need while you're waiting in the ED to be admitted? For example, how do you ask to receive a breathing treatment that you need every 4 hours, but you're still waiting in the ED? Dr. Dorsey?
That's a really hard one. I think you can, I think when you check in, when you get triaged, make sure they understand that it's been X number of hours since your last breathing treatment and you really need that coming up. And, they'll assess you at that one point in time, but maybe at 30 minutes or an hour goes by while you're still waiting to go back. And now your lungs are, they're in a different situation than when they were an hour or 30 minutes ago. I think you have to go back and tell them that, you are in need of another treatment. The other thing that you can do, and we often ask families, is just bring medications from home with you so that you have them, either just to kind of show what you're taking, or if you need to take it for some reason while you're waiting, you can take that medication. But it's always good to bring stuff with you, especially things that you can, like portable items and medications. I think those are the main things. Also talking about, if you have your card with all your medications, really identify, this is when I last took my medications. I'm due for it at, this hour. That may help them to understand the urgency of the type of medication that you need. I can't think of anything else. Kelly, can you think of anything?
No, I think that's accurate. I think bringing, if you are somebody that's on, multiple different medications that are portable that you could take, I always recommend that, especially in an emergency room setting. I think Colleen mentioned earlier, it's easy to forget, what the dosages are. Maybe it's a medication that you're switching, you used to take it twice a week. Now it's 3 times a week. And in an emergency, that can be hard to remember. So I would just try to have those with you.
Kelly, how do you recommend changing the dialogue when the attending physician decides that everything that is going on is due to anxiety, when there is zero evidence of anxiety in a person's medical history?
That's hard. So I think trying to really stay focused on the facts. I think it goes a little bit back to trying to get away a little bit from demands. I think sometimes when people present and because we care, right? Because we're either the patient and we're nervous and we're scared, or it's our family member and we're nervous and scared for them. We get very like, I need this, this, and this done. And I think that even though it shouldn't happen, sometimes that can be taken by physicians as, you're not a doctor and you're telling a doctor what to do, right? And they shouldn't feel that way, but I think that can happen. So I think that staying very calm and, having more of a conversation and just saying, listen, Dr. So-and-so, I don't have a history of anxiety. I right now am telling you that these are the things that have happened. This is what's currently happening. And my concern is that if I do not receive treatment for whatever the cause is of being ill, things could get worse. And I think that if you have a physician, again, that is just adamant that they're not going to work with you, I think that's when you have to just circumvent that and go directly to your immunologist or primary care phone call, or move beyond them with, starting with a charge nurse and saying, this doctor feels that this is anxiety, but blah, 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 blah. And so I think that you kind of have to circumvent it. If you've already tried all the ways of staying calm, you've tried the ways of conversation techniques to try to get what's needed, and it's not working, I think you probably have to move on at that point to another step.
Thanks, Kelly. Anything to add, Dr. Dorsey?
No, I think that's that covers really the high points. Again, as Kelly said, just really trying to have a conversation with someone. And it's okay to talk about what, I'm, like Kelly said, I'm concerned,
Mhm.
I'm worried. I'm really worried here. I want you to know that I'm very worried about this. I'm very concerned. This has happened to me in the past. I'm worried that we're going to go down the same road. And this is the outcome of what's happened in the past. So I think it's okay to express those kinds of feelings, but not not be demanding. Just really talk about your concerns and allow them to say, well, okay, if you're concerned about this, we'll do this, or you shouldn't be concerned about this because we have gone through X, Y, and Z. And then that starts the dialogue. Then you can say, well, have we done this? Because this is what happened when that was normal. And they'll say, well, okay. And then they may decide to do other tests or some other studies or other medications. So I think opening up the dialogue is really important to try and get that back and forth so that they know they can talk to you and you know that you can talk to them and sort of back and forth happens. I think if you come out the gate with certain requests and demands, that will be more of a sign like, okay, this person really is just going to ask for X, Y, and Z without my expertise. This is not someone I can have a dialogue with. But if you can open up yourself to say, I want to have this conversation with you. I'm really concerned, etc. So yeah, it's just a lot of people skills and it's different, in different situations. So.
And we have just a few more minutes, so I want to touch on just a couple more things. What do you do if they want to discharge you before you're able to connect with your doctor? This person's son is autistic and has CVID, and they've had 2 horrendous ED visits this year that did not go well at all. So what do you do if they're throwing you out the door and you have yet to be able to get that immunologist involved? Dr. Dorsey?
Yeah, unfortunately, we have come across these kinds of situations in the past. And often it means turning around and going to the ED that, it really knows you well or knows your family or your child really well. We've had situations where sort of a local ED has said, okay, this is what we're going to do, and we're not going to do any more. And then we're contacted and then we say, okay, no, let's just come straight to UCSF, for instance. And then in retrospect, it's kind of like, well, that's probably a better outcome anyway, because they may not have been able to handle or know what the right next steps would be for someone. But yeah, I mean, if they are in dire straits and really ill and can't even be taken home and back to this other ED, then I do think asking to speak to someone, maybe a supervisor, sometimes there's social workers that are working in the ED that you can connect with to raise your concerns. Try to connect with one person on the team. I think that's really key. If there's maybe an MA or an RN or a charge nurse that you're connecting with that can then speak to the physician and say, okay, this person's really concerned, we should be doing something. Try and find that one person that works if you're unable to get to your immunologist. Otherwise, unfortunately, there are situations where people get discharged and then they end up going to the ED that knows them, better, and after they've connected with their immunologist.
What about reaching out to a patient advocate?
Oh, absolutely. Definitely. That is so important. And yeah, but you could certainly add to more on that topic.
Any advice on how to communicate the need to be put in an overcrowded, need not to be put in an overcrowded area with a lot of other sick patients in the ED, or the person with a PI is at risk for picking up communicable illnesses? And obviously COVID comes to mind right away, but there's a whole lot of other crud in that building and in that area. So how, I know and will say that on the card that IDF created, it will say, I am immunocompromised, and it will ask to be put somewhere else. But how can you advocate to have your child somewhere where they are safer from the other people that are in the room? Kelly?
I think the first thing that we have to remember is kind of having realistic expectations. I think that, if you're in an ED that is packed and every single room they have is full, then it might be impossible to completely separate yourself from other people. So I think it's first having realistic expectations. Second is things that I've done in the past is said, you know what, I'm going to go wait outside. Can you call me when it's our turn? Or we're going to sit outside on this bench, and we kind of just separate ourselves outdoors. I think it's also important to remember that even though at that moment we are the most important person to ourselves, right? Like, or our child is the most important person in that ED is my kid in my head, right? There's a lot of other people, and we can't always see illness on the outside. So there may be other people in there that have PI. There may be, 80-year-old people in there that they're really immune compromised because they're 80 years old. So I think we also have to go into it with a realistic expectation and just, again, politely conversation. I'm really worried about my son waiting in this room with 4 other people that are coughing and appear to be really ill. Is there anywhere more private we could be? And I think if you're really polite, and again, you start with that, I'm concerned. I think that makes people listen. I think demanding, I have my own room when that might not be possible, is not going to get you very far. So I think just being really polite and stating your concern is going to get you a lot further if they're able to accommodate that.
And I think that goes with the last question that we have time for. Do you have suggestions for people who are stuck in a waiting room, have not gotten even to the triage nurse yet, or been triaged by someone who doesn't understand how quickly PI kids can crash, and you see that your child is decompensating fast? What do you do?
I would represent to the triage nurse. So all EDs are kind of set up differently, but if it's filled with 50 people in the waiting room, obviously they can't have eyes on everybody. But me as a parent, if I thought, my child's worse an hour later than they were an hour when we presented, I would go up to the triage or, up to the front desk, check it in and say, you know what, my child's getting worse. I'm very concerned. I need someone to lay eyes on him. And I think if you're very direct, but stay in your lane of stating your concern, I would hope that whoever is helping you at that time would recognize that you're concerned and you're being very direct into what you need at that moment.
Dr. Dorsey, do you have anything to add?
No, I think that's exactly right. It's hard to know, you're always tempering. I'm not going to overreact, but then you also need to say, okay, now I'm really, really worried. But it's okay to share your concerns. And if you do it in a repeated way that's respectful, then they know you're not there to make trouble. You're there because you are concerned about one thing, and your demands aren't so high. You're just saying, I need some reassurance that this situation's okay, and let them provide you with what they think the solution is, to help, mitigate what your concerns are. I totally think that would be the right way to do it.
Well, unfortunately, we have come to the end. I appreciate everybody asking questions and having their input into the chat and everything. But if you still have a question, ask IDF on the website, send it in. We will be glad to help you. And we are always here to support you. So with that, our time has come to an end. Thank you all so very, very much for being here. Thank you so much, Dr. Dorsey and Kelly. You have been amazing. I hope everybody has taken away some great wisdom and tools for their next visit, and we can get rid of the negative and stay positive and have good endings for everybody. And I also hope that you will continue to enjoy today's sessions and continue to learn other topics and things that we're all affected by in the PI community. We have 39 sessions, so there's lots of learning going on. But I thank you for being here today. It's been a pleasure, and I look forward to seeing everybody in further sessions.
Thank you.
Thank you.
Thank you guys so much. Nice to see everyone. Okay.